The Lalji family really does so much for health in the community, and I think when it came to the need for the urgent care center and the Laljis stepping up to do that, really showed that they cared and put women's health first, and that's something that's really important. We are honoring them because really they are one of our biggest supporters, and they really transformed the hospital.
For them to select BC Women's really reflects their own ethos of giving and really thinking thoughtfully about the areas of greatest need, and then for them to make that decision to say here at BC Women's Hospital to choose the urgent care center as the place for them to provide for their generosity.
The major difference before and after the renovation is the larger surface area. We almost quadrupled in size. We went from 5 beds to 10 beds. Equipment is also a huge difference between what we had previously. So right now in all 10 of the rooms we have IV poles, we have capability for laughing gas in all of the rooms. So we have different stretchers. In our previous state, if a patient needed a sterile speculum exam, she would need to move from one room to another. And now we can do everything all in their designated room, which is a lot better experience for our moms and our patients. We have designated rooms for infection control. So that includes a negative pressure room, and specifically with us going through, the pandemic and that sort of thing. We also have the capability of having a delivery in our room. The renovation has impacted us to provide care almost right away. There was a time in the past before the renovation where we would have only 4 or 5 beds, and our waiting room was quite full and waiting times were quite long. And now that's almost non-existent because of us doubling in size. So that, I think, is one of the key aspects of the renovation and moving forward.
My water broke 6 weeks early, so I called the hospital and I talked to the OB on call and I explained what had happened, and they said, okay, well, I think your water broke, so we need you to come in right away. It gave me a lot of sense of relief that I was coming here where there's no other place I could get better care. It's extremely relieved to be in the hands of the best doctors, the best nurses, and I thought that before, and I thought that after my experience as well.
When you have such high risk conditions, you just want to be somewhere where you know you're getting the absolute best care. I was admitted at BC Women's after 3 weeks of being at another hospital, and I felt, as cheesy as it sounds, truly like I had come home. I can't explain it. I just felt really safe because everybody here was dedicated to women's health, and it felt very thorough. It felt like I didn't have to be my own advocate as much as I did in other hospitals.
Philanthropy and donations are a huge aspect for how we provide care. Because of the generous contributions of the Lalji family, we are able to provide the best care for our patients.
I just felt like it was just such a patient-centered experience, and I cannot tell you how comforting that was.
If it weren't for the Lalji family and all the amazing nurses and doctors at BC Women's Hospital, I really, truly don't think my daughter and I would be here today.
I just wanted to personally express my gratitude to Mansour, Shanaz, and the entire Lalji family for your incredible generosity to the work of the BC Women's Health Foundation, and particularly making a difference in the lives of women that come through the Urgent Care Center every single day.
The Lalji family's commitment to giving back to the community is what this award is about, seeing the need and closing the gaps. We are so grateful to this remarkable family for their support now and into the future. Thank you so much. We are so grateful.